We are live.
Welcome everybody for another beauty
of the
of the
breathing
breathing
podcast.
Sorry, I
back
have
in
feedback in
my
my ear.
This is
This is
Renata,
Renata, your host.
After
After
the
the summer, we've been off for most of
summer,
the summer, so super excited to have everybody here
with a
with a very special guest. I'm gonna go ahead and introduce her.
So this is
So this is Dr.
Marisa
Marisa Santos.
She's an
She's an orthodontist with over 25 years of experience treating children.
Through
Through clinical practice, she recognized that modern life demands more than just appliances. It requires a comprehensive transdisciplinary approach.
Her
Her
three-phase
three-phase protocol focuses on diagnosis, appliance therapy,
and
and achieving optimal oral posture, a strong emphasis
on
on airway health from the nose.
Designed
for children over 6.
Her work
prioritizes pace, posture, and tongue function as the future standard of care in orthodontics.
Today's
topic is early transdisciplinary orthopedic treatment focused on airway. Welcome to our stage. Let us go live on Instagram right now.
So you may be listening to this as a
recorded podcast. You can keep following our show. Or you may be listening to this live on Instagram. If you are, please send us your questions, and we'll be happy to answer them as we keep going. With the How are you? Thanks so much for being here. Hello, everybody.
Well, hello. I'm here working in my practice with the ENT and with a myofunctional therapist,
Wow.
This is, I'm an orthodontics. I'm the chief of the master in university, but because of my little daughter, she was born like this with a class 3, we call the orthodontic people, and I said, this can't be possible. I have two other kids, and so because of her, I started a long search. And when they grew up, I went to study with John Mew.
Wow.
I
saw that. I know that.
He just
passed away.
Yes.
So
tell a little bit of how was to meet him for the first time. I know that so many people did not have the opportunity
of meeting him. I think that decision of I sold my car and I told my husband I will go for this man. This was many years ago, and this changed your life because he talks about the causes of malocclusion, And the first time I went to London, I went with all my teeth and my malocclusions, and he told me, you are stupid because you're an ortho, less stupid because you're here. Why are you showing me teeth? I want to see faces. Wow, So then I went 4 times there, and imagine next year his symposium is taking place here in Buenos Aires. So imagine the great life I have with him. I was going to London to make to interview him for next year, but then I take all his knowledge and philosophy and put it in little kids. He treats 6 and older, and I treat 3, 4, and 5.
Wow.
As an orthodontics. So my treatment focuses on airway, and I have a whole protocol that I do it in my pediatric center, here in my office in Buenos Aires, and everywhere, at university. So we have a protocol for these kids. Because you know, Renata, that these little kids, no one gets them. Pediatricians, pediatric dentists, orthos. So I'm an author that takes care of those kids and teach all around the world with this protocol to get care of these kids as an author, orthodontic. Orthodontics have to understand the importance of getting to those kids. John made a last letter, and that letter was, kids don't born broken.
Wow. Wow.
They don't born broken. We broke them. We broke them along their lives.
So what are some things that we do to break our children?
Anything, everything, the bottle feeding, allergies, sucking of pacifiers, and then allergies, and we can't avoid that. But John was my first master, but then once in France, I had the opportunity of seeing a conference of Maria Pia Villa. She will come to Buenos Aires next year. And so it's John and then Maria Pia Villa. And she talked as a pediatrician of the importance of the orthopedic treatment in treating kids, but kids of those ages, 3, 4, and 5. So my protocol, the appliances are more focused on Maria Pia Villa than in John. I get John's philosophy, but I work with orthopedic treatment, hard orthopedic treatment in kids. But with the whole protocol, I can put the appliance, I can do it myself, whatever you want. But if we don't have the protocol, if we don't have the ENT and the tongue time and all that first, and we don't have the myofunctional, in the middle of the active treatment, we start with myofunctional therapist, focusing of good oral posture. You know that John created the tropic premise. The tropic premise is teeth together, tongue in the palate, breathe through your nose. Teeth together. Kids lost these teeth together and they start with an open mouth posture. I'm here today and I saw 6 kids coming like this. And so kids are with an open mouth posture, and so the tongue is not there in this part that is the upper airway, the bone upper airway, and so that part is not growing. So that's why I don't understand my own profession. You know that the AAO still is saying you have to start at the age of 7. Imagine, sutures are closed at the age of 7. So how can you imagine that growth is when you're born, intrauterus, and we will treat kids at the age of 7. We will treat pathology. We will treat malocclusions. We are treating craniofacial problems. So many people are involved. The ENT, the orthodontics, and the myofunctional therapists. These are our protocols.
What is your protocol usually in your practice? There's a huge question over here in the United States about should you do orthodontics first, should you do myofunctional therapy first? Is there a way to both of them together? I just want to understand how you guys think there, especially with the training you've had. By the way, before I say there's back to my boy. And I do
hear
myself. I'm
myself.
not
I'm
sure
not
if it's
sure
going
if
to
it's going to
record
be
like this.
recorded like
I
this.
hope
I
not,
hope
fingers
not.
crossed.
Fingers crossed.
But if you
But if
guys
you
cannot
guys cannot
understand me over
understand me
here,
over here, you guys are
please
listening,
let me
please
know
let me know
if there's
if there's
echo to my
echo to
voice.
my voice.
So
Go ahead.
my
Go ahead.
protocol is, I have a protocol that it's not mine. It's from, I took it, I stole it for a myofunctional therapist, Diana Grande, that she is Argentine, but she worked in Barcelona. And she put a protocol with an ENT and an ortho. And as I said, can I take this? I take the protocol and then I make a lot of changes until the protocol we use now. So we have 3 consultations. There is a PQS of Gilly Minot. So I will send you my protocol with a lot of questions where we evaluate clinically nostrils, we evaluate the frenulum, we evaluate the adenoids, and many things. And then we ask for some studies, very few studies. We refer in every case to the ENT, but asking for airway, but nostrils. So we evaluate with rhinomanometry in every case, in every case.
I have a good friend,
Dr.
Dr. Karen Davidson, that runs the rhinomanometry.
So that
Can
is
you
what,
tell people how does that work? What age do you usually do it for?
so we make the protocol, the ENT. We measure the kid 3, 4, 5, and 6. Then 7, 8, I don't treat them now. We treat everyone at university, but my expertise is 3, 4, 5, 6. So we make the rhinomanometer first, and then we evaluate after expansion, upper and lower expansion. And in the middle of the treatment, they start with a myofunctional therapist with appliances. They start with chewing and breathing. And when we take out the appliances after 6 months, they start with good oral posture. So, and we use GOPEX exercise, or we use the Engelkes maneuver, ab locker, active lingual. There are many now in the world. But whatever the myofunctional therapist focused or uses for good oral posture. So 3 months with a myofunctional therapist, and then we say, well, I see you in 6 months. And the real things comes when we see the kids 6 months after. Because of course, a kid of 4 years old will be perfect with the appliance. The screw will turn. But then what about all the functions, all the posture? So then we measure again the palate when he comes in the 6 months. And there we say, well, something has happened. And it's always the oral posture. That is the most important thing that happens now. So
At what point do you, I'm going to turn your mic off and speak, and you guys tell me if there's a feedback to my voice now. At what point do you guys recommend taking tonsils and adenoids out for them to go that route, going to an ENT to have tonsils and adenoids evaluated?
Well, that is not my what I decide. No, so in every case, in the second visit, I refer to the ENT, and he makes a lot of tests. One is a rhinomanometer, another test whatever he wants, and he decides. I work changing lives with no surgery. When I get a kid of 3 years old with adenoids 1, 2, 2, 3. But when the kids have 3 or 4, we don't change things because they have to go to surgery. But you know that if you get a kid of 2 adenoids, 2 classification, when all this changing in the structure, in the bone structure of a kid, and my functional therapist and achieving good oral posture, adenoids disappear. That's so important, you know. So the impact we put in a kid doing all these things is terrible. It's another kid, you know. But this I do it for 25 years. I'm professor at university for 25 years, and I don't know why everyone is not doing this. Why we wait and we are, you know, putting plates and marpe. I love my friends at university that do that, but I said, why all these kids going to that way if we can solve problems so easily with a very, very clear protocol at those ages, preschooler kids. So there are many pediatric dentists in the United States doing this. Kevin Boyd will come to Argentine and we work together a lot of years. So, but I'm an ortho and I want my ortho community to do this, you know, because it's so, it's a very great difference if you start at the age of 4 than if you wait and start at the age of 7 and 8. So the problem is the American Association of Orthodontics. Why they are keep on saying start at 7, I don't know. You know, I will not wait with my daughter. I will not wait with my granddaughters. I will not wait. Never wait.
So what kind of recommendation do you have for parents listening to this that are taking their kids to an orthodontist and they are telling them there's nothing we can do right now, or the kids are going to grow out of it, or I have time to do everything that I need to do when they're older?
Well, you know that I don't have many pupils in United States, so you are there and that's not, I went there, I give lectures, but it's more for pediatric dentists in the United States. Orthos are still saying no. Here in Argentina, it's different. You know, I'm the chief of the master in orthodontics and I do it in kids of 3 years old, at university, at the Argentine Society of Orthodontics. So here is different, but it depends. So it creates a lot of, frustration for parents because they know me, they know what I do, but they can't come to Argentina. Now, today, I have 2 kids coming from Holland, you know. It's crazy. And Switzerland, and no, because this is something we have to do in a teamwork with kids. I have a map in my Instagram for people going to a doctor near. So sometimes in the United States, it happens that I give all this information and they call me, they make a meeting saying, well, but he told me no, he told me not, he told me to wait. And my friends go to the AAO, to the American, or, you know, I applied 3 times with all my curriculum there to say, I want to talk. And they said, no, we are not interested. So that's a problem. If I have to say that as an author, I have to wait till 7, I break my title. I'm not an orthodontic anymore. And I'm an orthodontic and the chief of the master. So I don't understand what's happening there. So parents get a lot of frustration, and you also, my functional therapist, because when you work with everything, the kid goes to you with everything solved, adenoids, tonsil, frenulum, the expansion, upper and lower, the face mask, everything. And they go to my functional therapist. Oh, and so you are like this, saying, this is grateful. But then a kid comes, you said, no, he has, because you can see a malocclusion. I don't call malocclusion. We have a craniofacial problem disorder. And you know it, and of course you know it, and you have to work with that kid with that so you can't work. You can't work with a crossbite, with a palate of 22. You can't work. But
thank you so much for saying this, because first of all, there are a lot of parents that, come to us thinking that myofunctional therapy is going to prevent these children from going into orthodontics. It does not. And just to let you guys know, I'm trying not to say anything at all because I have a feedback in my mic, so it doesn't show up on the recording. And every time that I'm speaking, I'm going to mute you, and then people will be able to hear it well. Anyways, but a lot of parents come to us thinking that myofunctional therapy will fix their children's orthodontic issues, and they don't. They work hand in hand. I always tell everybody that you have 3 pillars. You have to address the 3 pillars. One, it's the airway, this tube. I've said this on here before. It needs to be free and clear. Upper and lower jaw need to be big enough to house the tongue, and the tongue, the lips, the cheeks, the throat muscles, all of those need to be toned up to be able to function correctly. If you only address 1 or 2 of them, the child will relapse. The biggest challenge that we have in the United States is that these kids will come to us, orthodontists. Sometimes we even send us patients, and craniofacial wise, we can see that there's an issue. Either the maxilla is too far back, or they're class 2, and a lot of class 2 patients where the lower jaw, for those who do not understand what a class 2 is when the upper teeth are farther forward. They look like they have buck teeth, kind of, but a lot of times whenever they have an occlusion like that, they're actually bimaxillary retruded, meaning upper and lower jaw are too far back. And the orthodontist will look at me and be like, what do you want me to do? I can't make that overjet even, bigger. What am I going to do with the mandible? And I say, I'm not an orthodontist. I don't know what to do. But there are people out there that are working on this that you can reach out to. We have an incredible group with Airway Circle. If you guys are not part of an Airway Circle, we have 2 Facebook groups, one for parents, one for professionals. So if you're a parent here and you're trying to find a professional to work with, you have a couple options. Go to Facebook, Airway Circle Patients, and over there you can ask questions. There are other parents going through the same things you're going through. You can ask for recommendations for providers around your area. And we also have a directory in our website. Go to airwaycircle.com/directory, and you can search your area for professionals who have a little bit more of this knowledge.
yes, but the problem is that when you have, we have now scanners. I bought the scanner only to measure maxillas, and that's my thesis and what I will present in the symposium next year. And this measurement will not arrive to 42, as John Mew says. I said John in other life, not now, because it's impossible. But we have to address some kind of palate, palate, knowing a palate of palate knows, no, not palate. It's not a palate. We don't work with dental-alveolar expansion. I work with sutural expansion.
Can you please explain to people what that means, alveolar expansion versus suture expansion?
That when we have a kid till 7 years old, you have sutures. Sutures are places where they are open, so you can address bone. You can change structures. So, yes, I'm not in my office to know what I do. So when you address this and this with a face mask, you are going to sutures. I don't work with dental alveolar changes. Dental alveolar changes are changes in the teeth. So to help a kid breathe and to help the myofunctional therapist, we have to go to sutures. And when you put a suture in a kid and you go like this and upper, so the kid breathes. He breathes and you can work. If not, you can't work. And
Thank
so
you.
now we have a lot of Invisalign and many things that are dentoalveolar. But mothers, if mother come and they have money and you tell, Marisa will put you all this with a face mask and all that, or she will put something, a liner that you take from a box, but that will not do this. You understand me? So I work, really, it's a medical treatment. It's an orthopedic medical treatment for breathing. This is not aesthetics. This is not about teeth. This is not nothing. So now we have a great problem with all these things that come. And many doctors, as they don't know how to use this clearly in a 3 years old, so they start putting, I don't know, whatever, something here, I don't want to give names, but something that it's very, very easy and of colors and a lot. But now you need to break that suture because you need to breathe, and then you start. And perhaps you put a...
Sorry. What did you say? Go ahead.
So this is something that, imagine, I start working with kids when I was 22 years old. I keep all my, and I'm an orthodontics. So, and I want orthodontics to notice. This weekend, I was in my house, in my big house, getting rid of some papers, and I saw papers talking about expansion, disjunction. And so I said, this was when I studied, so what we are discussing this? All things function, but parents are with all these new things but they don't work. They don't work.
Thank you for saying that. Oh my gosh. There is a lot of marketing out there. A lot of desperate moms don't know where to run to. Somebody just said, Donna just said, 100% frustrated parent here with a 3-year-old who I've been trying to help since 1.5. Yes, we do not have enough providers that have this training, that know exactly what to do. This is why we created a community that can help you and guide you. So please share what we're doing over here, because there are other moms out there that have the same frustration that you do, that are trying to find the professionals that are actually trained in this. I would love for Dr. Marisa to share with us if somebody does want to come see you. You do see people from all over the world, which is incredible. So if somebody wants to come see you, 1, what do they do? And then 2, do you mind sharing a little bit about the conference that you guys are having next year?
Well, I have many ways of learning. Now social media is going the wrong place, because social media is getting more and more patients for me, and I need more professionals, more orthodontics that want to understand. When people come, we have the magister, but the magister is 3 years in Buenos Aires for orthodontic people, so that's okay. Then I have here in Argentina, they come to the Argentine Society of Orthodontics. I have a training, 2 years training, perfect. And then I have my online conferences for many doctors all around the world. So that is different. I get all the information, and then they share cases, and they start working with a lab and many things. And so they get to the same place, but it's different. Perhaps it's more long, no? And they come to my practice also. And next year for me is like, well, I finished like this, you know. I know that I was kind of, life was a gift for me, and I went to John, I went to Maria Pia Villa, I went to Wilfred Engelke, I went to, so everyone is coming for the 20th Symposium of International Association of Facial Growth Guidance. So John told me, you do what you want, Marisa. You do what you want. So I put it in, not only in orthotropic people, that is John's community, but I opened that for early treatment. So 4 ENTs around the world are coming. Maria Pia pediatricians are coming. My functional therapists are coming. Physiotherapists are coming. Everyone. I have no
When is
more
it?
place.
When is it?
It's in September because it was John's birthday. 4, 5, and 6 in September next year in Buenos Aires. You know that this is a lot of effort for me because it's a number 20 and all the others were making in Canada, in London, in Seoul, in Poland. We are in South America. John wanted this to happen, but it's a lot of money, it's a lot of effort. It's not my comfort place, you know. I can talk with you, I can talk wherever, I can go and talk, and I have no problem, but this organization, this money needed to do this, and as I don't have any, you know, anyone who gives me money, because this is science, and this is love for kids. I don't have someone to put money because I do Invisalign or whatever. No. They want me to do that, but I will not because I don't believe in that. So it's very difficult, but I think that we have to open all the world's eyes, and all my pupils know they have to go there. Everyone is coming. The one is not coming is because he's deaf. Everyone, all my teachers, all my fathers are coming, and they all say, yes, Marisa. We have 30 international conferences coming here, from Poland, from United States, from Australia. Simon Wall will be coming, Bill Ham will be coming, Kevin Boyd will be coming, Maria Biabella. Everyone will be here.
Okay. So we will share a link for anyone who's interested in attending the conference in Argentina. I would love to go to Argentina. My Brazilian home is right next to it, and I've never been. My sister lived in Cordoba for 3 years, and I've never visited. I need to. So it'd be amazing to come down. If you can share a link with us, we're going to put in the Airway Circle Professionals group. We'll share with everyone. And if somebody would like to work with you, at what age do you work with? How long do they have to stay in Argentina to be able to have an evaluation by you?
Look, it's very simple because we don't make long treatments. But first, there is a consultation with ENT and all those things. Lingual frenulum, we start with a kid that is perfect to start. And you know, the treatment lasts 6 months. 6 months and 3 months less of my functional therapist. And then we stop. And we keep on evaluating the kid 6 months or 1 year. There is a difference between kids. When I started, I described in my first international lecture was in Chicago, and I called modern kids at that moment. Now I call them syndromic kids, and I need another name because kids are worse and worse and worse. We are not going to a better place, we are going worse. And so we need all these things to happen. That's why I make a space in my consultation to talk to you, because we need to keep on saying this. Because I don't want to be a mother, as it happens to me, with a father, doctor, everyone was a doctor, and the lingual frenulum, no, so the breastfeeding was awful of my first boy, and all these things that I was as mother, 21 years old, I said, mothers, they come from saying, I don't see a professional taking this boy and trying to help him. And so,
do you do consultations online?
Yes, but that's a frustration system, because I make the consultation and where do you go? Where can you go? In United States, I went to San Francisco and gave a lecture some years ago, and they don't want to do it. So from the ortho community, there are many pediatric dentists working, and I have now two that came to Colombia to take my conferences, and so things are rolling, and we are starting. I'm finishing because I have 25 years of telling all this, but things are happening. So to make like a summary, 3, 4, and 5 is an age that you go there to improve health. No matter about teeth, you improved health. There are very short treatments, very protocolized. So this is like this is like this, and you finish. The only thing that it's mathematic and that will work is the appliance, because you turn a screw in a 4 years old and everything will go okay.
Is that appliance something you develop? What appliance is that you have?
Yes, this is my appliance. This is my appliance I developed. Yes.
It's beautiful.
So we go in 3 dimensions: transversal, anterior, posterior, and vertical with the appliances. So the kid has a broad maxilla, not a broad maxilla we are inventing or creating. The maxilla he deserves.
Was supposed to have all together. Is your name for that appliance?
This is MS Marisa Santos, because I developed the appliance. So it's a mix of John's stage 1 BioBlock orthotropics with Hyrax. The Hyrax I learned many years ago, so I create many things. So things are like very simple for kids, for professionals, because we can say, yes, this is perfect, yes, but then you have to put it to a kid of 3 years old. So it's something very, very easy to do, and it works. It works. We change lives.
So for those parents that don't have an orthodontist or pediatric dentist that's doing any of that right now, and they have a child who is younger than 6, let's say, would you recommend them seeking myofunctional therapy first?
But the myofunctional therapist would be frustrated as a parent, because you can't work with a kid of 20 millimeters. We took 108 patients last year, and they all measure less than 26 of maxilla. So what can you do with a myofunctional therapist with that maxilla? So you can improve, but it's all energy lost of the boy and the family, not working with a broad maxilla, with the tongue having space, and with all that. So it's not the myofunctional therapist, as there's not, some parents come to me and said, I want you to put the appliance. Oh no, it's not the appliance. In my pediatric dentist, first they go to the physiotherapist, then they go to the appliances, they go to myofunctional therapist. So it's a protocol, it's a whole treatment. It's not my appliance. It's not my appliance. My appliance it's not important. It's all the protocol, the important thing.
100%. And we're going to have Dr. Marisa back on Airway Circle TNL. We call it TNL, Thursday Night Lives, to go a little bit deeper into this. If you guys are not following Airway Circle, every Thursday night, we have a live lecture. It's an online Airway study club. So it is a free resource that we offer patients and professionals, mainly professionals over there. We go a little bit deeper into things with PowerPoint presentations, but it is free for everybody to watch it live. The directory on our website is free to join, it's free to search. However, after our webinars go live, we put into our membership portal. So only the members have access to the recording and to over 200 lectures that we already have. And we thank our members that let us. They are the ones that are supporting Airway Circle to be able to offer these free resources. So if you're not a member yet, please join us. This is the last week to get the membership at $397 a year forever. It never goes up for you with the code TNL. So Dr. Marisa, I have so many more questions, and there are so many questions coming in over here on Instagram, but I know that we're short on time. I would love to continue this conversation on Airway Circle, or maybe we can do another one of these a little bit more. Patients are asking, what is the earliest age that we can do this treatment? You've mentioned 3 years old. Somebody said, my son is 12. Can he do it? My nephew has mouth breathing. He's 8. Is that a bioblock device? Yes. Something else that I was going to tell you guys, if you do not have, we have tons of patients that are in more difficult rural areas, more difficult to find the right professionals. So doing an evaluation, I think it's a huge step, either with Dr. Marisa so she can guide you in the right direction, or with a myofunctional therapist. I do see patients only online. If you guys want to do a guidance call, it's a 30-minute conversation that we have. We see patients in over 30 countries. You guys are welcome to reach out to us. Go on the website and make an appointment. Our schedule is right there. And we can look at everything and also just give you a step-by-step what to do, because this world is overwhelming. A lot of times we're like, oh my gosh, I have all this information. My child's mouth breathing. What do I do? There are tons that we can do with the resources that we do have. So if you don't have an orthodontist right away to start palatal expansion, first, we're going to try to find one. 2, we're going to try to talk to your local orthodontist to see if they are willing to work with us to collaborate and get something started. But going ahead and getting the knowledge and the awareness of your tongue position, of nasal hygiene. Nasal hygiene is huge. Everybody should be cleaning their noses. So there is a lot that we can start doing by doing a really good evaluation, seeing if you have a super low soft palate. Maybe you need to go see a sleep surgeon. We don't know exactly what kind of patients are coming our way, but get your evaluation first. Get that talk with somebody in this field that's fully invested in your health, so you can get a step-by-step guide what to do. Can this help a tongue-tied mouth breathing 55-year-old? In terms of airway treatment, yes. We don't know exactly what you need. However, start with an evaluation and we can help you find exactly what is the next step for you. What should be the first step for a 5-year-old with a lip tie? Could you share membership details? Where can I find? Go to airwaycircle.com and all the membership details is there. All right, last question. This is for Dr. Marisa. What should the first step be for a 5-year-old with a lip tie?
Well, it's not, the first, they come, this one day will be the pediatrician. The pediatrician will guide all this. But at the moment, they come to me and I've evaluated a lot of things, and then we start with the consultations with the other professionals. I don't do it myself. I make a lot of courses about tongue tie and frenulum, but I work with a team. I do the appliances. I'm orthodontics, so I make this and the other things. I have a team here. So we can evaluate, we can do it. I have a lot of pupils now that are coming from United States to help all your mothers. But we have online consultations, a lot of online consultations. But and many young orthodontics that are having another open mind, no? So, well,
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank
Thank
you,
you. Thank
guys.
you, guys.
Sorry about the feedback noise today. You guys were wonderful. Thank you, Dr. Marisa, for spending this time with us. You guys are absolutely wonderful. If you have any questions, please don't hesitate to reach out to both of us on Instagram. I'm from India, and I feel there's very less awareness regarding myofunctional therapy. Even dentists are not much involved. There are actually several people that are students of mine in India. Reach out to me, and I can connect you. Thank you. Thank you, guys. Have a wonderful day. And please remember to follow The Beauty of Breathing in your favorite podcast platform and share this with your favorite friends. Have a wonderful day. We'll see you next time.
bye.